friends, Pradeep Pindyala. Let's discuss the basics of anesthesia and let's chat about it. Absolutely basics. Talking about bronchiectasis, I'm sure you know. Bronchiectasis is a permanent widening and scarring of the airways of the lungs, often due to repeated or severe infections. What about bronchitis? Bronchitis is inflammation of the large and small airways of the lungs. Acute bronchitis is often due to viral. These are the small things we talk during Viva, the morning session. Okay, what is emphysema? Emphysema is a lung condition where the air sacs or alveoli become damaged. So what happens? These air sacs supply oxygen to the blood. So when they are damaged, less oxygen enter the blood. And what do you understand by chronic bronchitis? Chronic bronchitis is a lung condition that destroys tiny hairs called cilia, the airways of the lungs. COPD, chronic obstructive pulmonary disease, is a collection of lung diseases that cause breathing problems and also obstruct the airflow. The group of diseases can include refractory or severe asthma, emphysema, and chronic bronchitis. All these three are part of COPD. Most people with asthma will not develop COPD, and many people with COPD may not have asthma. Strange but true. COPD and bronchiectasis are two different but related diseases that occur separately but can also coexist. Got it? Okay. Chronic bronchitis, I did mention, is a part of chronic obstructive pulmonary disease, and the symptoms last for 3 months or maybe more, and subsequent episodes of bronchitis can come and go for 2 or more years, followed by recovery from the initial episode. Shall I repeat it? Chronic bronchitis is a long-standing form of chronic obstructive pulmonary disease. Symptoms from chronic bronchitis last for at least 3 months, and subsequent episodes of bronchitis can come and go for 2 or more years following your recovery from the initial episode. Got it? Why do they call blue bloaters? And why do they have edema? Have you thought about it? The mucus forms when the airways are irritated. Everybody knows, irritated and inflamed. And this mucus makes it harder to breathe. The body does not take enough oxygen, obviously, resulting in cyanosis. This causes an increased strain on the heart, eventually leading to right-sided heart failure and edema. So simple to understand, isn't it? Blue bloaters are so named as they have almost normal ventilatory drive due to decreased sensitivity to carbon dioxide, secondary to chronic hypercapnia. They are plethoric, red-faced cheeks due to polycythemia, secondary to chronic hypoxia, and cyanotic also due to decreased hemoglobin saturation. People with emphysema are often called pink puffers. Do you know that? I'm sure you know that. Because they have difficulty catching up with their breath and their faces redden while gasping for air. Ain't it? And you have already known about bronchiectasis, the basics which can and will be asked during the Viva. Okay, and you should be able to answer that. Have we thought about the restricted lung disease caused by fibrosis? This is the cause. It is easy for a person with the restricted lung disease due to fibrosis to breathe out quickly. So that causes the ratio, FeV1 by FVC ratio could be even higher than normal. For example, even more than around 90% as opposed to 80%. 75 to 80% is normal. But the persons who has restricted lung disease like fibrosis breathe out quickly. That can cause the ratio even to the extent of 90%. And this is because of high elastic recoil of the stiff lungs. Talking about methylxanthine, all these things, I'll talk something very, very interesting about them. There is some test called post-bronchodilator test. Okay, BD test, and commonly referred to as the reversibility test. It's a test that utilizes spirometry to assess possible reversibility of the bronchoconstriction, usually in diseases like asthma. What are these beta-2 agonists? The first example which comes to your mind, beta-2 agonist, is Ventolin, nothing but albuterol. The Alupent you can call it. Terbutaline and many others, but these two you should definitely remember. Okay, and salmeterol is long-acting beta agonist. Okay, salmeterol. It works by relaxing and opening the air passages in the lungs, and that causes easy to breathe during asthma. Bronchodilators such as ipratropium and glycopyrronium. I always ask this question. Why this bronchodilators such as ipratropium and glycopyrrolate are not exactly anticholinergic? Can you think of the answer? Answer is very simple. They are basically antimuscarinic but not anti-nicotinic receptors. So hence, they only block the muscarinic effects of acetylcholine and unable to antagonize the effects of acetylcholine on nicotinic receptors. Hence, they are not anticholinergics in the true sense. Ain't it? Short-acting beta agonists, which are the example? Albuterol, Ventolin, I did mention. Levalbuterol, all those things. Talking about phosphodiesterase 4 inhibitors, do you know that PDE4 inhibitors are the drugs used to block the degradation of phosphodiesterase 4, PDE4. Hence, the cyclic AMP. What is cyclic AMP? Cyclic adenosine monophosphate level increases, and that causes bronchodilation. That's how PDE4 inhibitors work. Okay, the PDE4 family of enzymes are the most prevalent PDE in the immune cells. This you should be able to tell, isn't it? And if you are doing extremely well, they do ask what are the examples of PDE3 inhibitor. If you can answer cilostazol, dipyridamole, milrinone, and ambrinon. These are the PDE3 inhibitors. ठीक है? And PDE4 inhibitors, roflumilast, apremilast, and crisaborole. If you can answer this, the examiner will be really pleased. And PDE5 inhibitors, sildenafil. What is sildenafil? You must have heard it 100 million times. This is Viagra, sildenafil, PDE5 inhibitor. Tadalafil, vardenafil, avanafil, and non-specific PDE inhibitors are theophylline. That's the best example. What are the systemic corticosteroids? Prednisone, prednisolone, methylprednisolone. beta-methazone, dexamethasone, hydrocortisone, triamcinolone, okay. Systemic corticoids are widely used to treat autoimmune and inflammatory skin diseases. Prolonged use of glucocorticoids should be avoided. That can cause serious side effects. These side effects are potentially minimized by carefully monitoring and using appropriate preventive strategies. As I have mentioned, methylated xanthines or xanthine derivatives, methylxanthine, include several different compounds such as caffeine, aminophylline, paraxanthine, pentoxaphylline. And tea and coffee are natural sources of caffeine. I'm sure you know, ain't it? And methylxanthine represent a unique class of drugs for the treatment of asthma. The methylxanthine theophylline has demonstrated efficacy in attenuating the three cardinal features of asthma. What are they? Reversible airflow of suction, airway hyperresponsiveness, and airway inflammation. These are the three cardinal features of asthma. You might be asked during Viva, what are the three cardinal features of asthma? You have to answer reversible airflow of suction, airway hyperresponsiveness, and airway inflammation. And methylxanthine are the unique class of drugs for the treatment of all these three cardinal features of asthma. Sometimes you ask very basics and you're bold, caught behind the wickets. They may ask you a simple question like, what is respiratory failure? Type 1 and type 2. What is the difference? You may be knowing, but suddenly somebody asks, you will be knowing all big things, and the simplest possible things you might not answer effectively. You should be able to say, respiratory failure is divided into two types, type 1 and type 2. Type 1 respiratory failure involves low oxygen and normal or low carbon dioxide, whereas in type 2, invariably, there will be low oxygen and high carbon dioxide. Okay, low oxygen means less than 60 millimeter mercury, and PaCO2, if it has to be more, it has to be more than 50 millimeter mercury. So these are that. Thanks for patient listening. Have a wonderful day. This is Colonel Pradeep Pendyala signing off for today. Happy Friday and happy weekend. Bye-bye. Take care.